Radiation therapy is another excellent option for men interested in treating their prostate cancer. One of the challenges with radiation is that it tends to be a longer journey. The radiation, what's called IMRT, intensity modulated radiation therapy, or even proton beam therapy, has the challenge that it is a longer therapy. It takes anywhere between 7 or 8 weeks to get the entire therapy completed. And the way that I tell patients this is that you got to think about radiation therapy as a whole, with the exception of brachytherapy, which is just a one-time punch. But the radiation therapy, the external, when you're sitting from the outside, is a 15-round fight. You got to come in one day, you do it. The next day, you hit it again. You just can't give a high dose of radiation directly into that prostate, at least all in one setting. So you're just constantly hitting it back and forth again, okay? Brachytherapy is different though. Brachytherapy is putting those radioactive seeds directly into the prostate, and by putting them directly in the prostate, that radiation is released routinely over a period of, within the first 24 hours, and sometimes even longer than actually cause that radiation to cause that scar tissue down. We have lots of challenges with either of these, and I think that, at the end of the day, it's important for you to discuss with your urologist all of the risks and benefits of any of these therapies, and it's important that you understand that all of these therapies have advantages and disadvantages, and you need to write that down and figure out what is the best way and what do you feel the most comfortable in terms of getting your prostate cancer treated. We also have what's called CyberKnife. Now, CyberKnife is a relatively new way in which we treat prostate cancer, and it's done over a period of 5 days. So that's sort of in between that brachytherapy, which is put those radioactive pellets in, and radiation therapy, the IMRT or the proton beam, which takes 7 or 8 weeks. It's not done, I would say, commonly. It's still relatively rare in specific centers on that. We have some experience with it. And the advantage is, again, that you did everything done in a week. One of the challenges is that we do worry about the potential that if you're giving that high dose of radiation, could you have more side effects? So again, it's not offered in all areas in the United States. It's a potential option. And just like any of these therapies, you need to go over the risks and benefits with your physician and try to figure out which one is the best for you.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.